See how these invaginate? And see how these groove down? They dip down to fit the condyles. Okay, and that enables us to move our head in the yes format. So the joint between the occipital condyles of the occipital bone and the first cervical vertebra enable us to move our head in this fashion, the yes format. Are you okay? However, the joint between, this is an aside because we're still just on the skull, the joint between the first and second cervical vertebra enable us to move our head in a no format because they create a pivot motion. We're going to get to that next time we meet for lab. That's the last exercise 13. Are you okay? I'd like to move on. External occipital protuberance. You know the little like bulge that you may see in some individuals who may have low hair or a bald head? You can feel this. This is the protuberance right here. External occipital protuberance. Okay. This serves as a point of attachment for some of the muscles in this area here, which you'll see later when we focus on muscles. External occipital protuberance. Is everyone okay so far? Okay, I'd like to move on to the sphenoid bone. The sphenoid bone. The sphenoid bone is an irregular bone. You may see it like so at a station because it's so unique. I think this is fair. It's not a trick or anything of that nature. I think because this bone is so unique in and of itself, I can have it at a station by itself. And you should be able to identify it as sphenoid bone.
Like
Are you okay?
Bat shape. That's where the
Yeah, the like butterfly shaped or
bat shape.
you said bat shaped. Yeah, because you can see the wings. Now, if you can take a second, please, and just acclimate yourself to the location of the sphenoid within the skull, please. You can superimpose the sphenoid, please. Can you see its location within the skull? Here, here. Sphenoid bone. It is an irregular bone. Now we have several surface markings. We have the lesser and greater wings, okay? The lesser wings are these two, right? The smaller wings. Lesser wings are the two smaller bone markings that I'm pointing to. These are called lesser wings. Lesser wings. Lesser wings. The greater wings I am touching. The greater wings I am touching. Greater versus lesser wings. I am touching the greater wings. I'm touching them. Okay, now do you see these, just out of curiosity, do you see this area here? This is part of the superior orbital fissure. Do you see? Superior orbital. It is very difficult to find the inferior. I wouldn't ask you for the inferior orbital fissure just with looking at this bone. That is too much. I could ask you for the inferior here because I think it's clear. I'd like to move on, please. Sella turcica and hypophyseal fossa. Another name for the pituitary gland is hypophysis. The sella turcica means Turk's saddle. It's an area located here in this immediate region. Now, if you look at what I'm encircling, you'll see an invagination, an area of invagination, a groove. That's called a fossa. Do you see it? It's called the hypophyseal fossa, but I'm actually encircling the sella turcica, the region of the sella turcica, but within the sella turcica is the hypophyseal fossa. Can you see it? The pituitary gland is protected by this fossa, okay? Next, optic canal, foramen rotundum ovale spinosum. Okay. The optic canal. Can you see this? See that hole? See that opening? That is the optic canal. The optic nerves penetrate through that opening. Optic canal. Optic canal. Can you see it? Optic canal. Optic canal. Now this is the perspective from the other side. Can you see it? This is the optic canal. It is a surface marking associated with the sphenoid bone. It is a hole within the sphenoid bone that accommodates the optic nerve. Optic canal. The optic canal. Can you remember ROS? R-O-S. ROS. R-O-S. Rotundum ovale spinosum. If you look at this sphenoid bone,
That's me all up.
do you see this hole right here?
Long time.
Do you see this opening right there? That's the R. That stands for foramen rotundum. Okay, now if you look further down, this is all occurring in one column. Do you see this oval-shaped opening right here? I don't know what the perspective is. This is the foramen ovale. Do you see it? And then do you see that circle below the ovale? Just below that hole. Immediately below. Right here. This is the spinosum. ROS, rotundum ovale spinosum. They are foramina. Foramen rotundum is the first pointer above here. The second is ovale. The third is spinosum. ROS, R-O-S. Foramen rotundum. Foramen ovale. Foramen spinosum. All of these foramina accommodate either blood vessels, nerves, or both. Foramen ovale, spinosum, and rotundum, not in that order, though.
Is the optic canal in there too?
Oh, yes, it is. It's not in this row, it's above that row, okay? Can you see another circle in there? Here.
Soul circles.
Okay. This first pointer is on the optic canal. Can you see it? Can you see the optic canal? Can you see it relative to the foramen rotundum? That's great. You got it. Isn't it more associated with the lesser wing? And the rotundum ovale spinosum are associated with more so the greater wing? That's another way to think of it, if you like. The lesser wing has the optic canal. The greater wings have ROS. Okay, now from this perspective, you should be able to recognize the sphenoid bone. It may be hard to see the border of it. Isn't this the greater wing, part of the greater wing of the sphenoid bone? And this is part of the lesser wing, you see. So I have the pointer on the lesser wing. I have the pointer on the lesser wing. You see the greater wing here? And I have one pointer inserted in the optic canal, because I know it's a part of the lesser wing. Okay? Here is foramen ovale. Here's foramen ovale of the greater wing. You see foramen ovale here? Can you see spinosum and rotundum relative to ovale? It might be a little tricky. I'm not sure because I can't see what you see. My perspective is off a little bit. But I know I have it in the ovale. Foramen ovale. See the oval shaped? Foramen ovale. Foramen ovale. Can you see spinosum below that? Can you see the foramen spinosum below that? On this side, I have it in the foramen spinosum. Can you see it? Can you see ovale above that? Can you see the optic nerve there? Can you see spinosum, ovale, rotunda? Okay. Can you see that I have this pointer in the foramen rotundum? Can you see the spinosum and ovale? Can you see the foramen rotundum? Can you see the spinosum and ovale as well? And the optic canal? Superior and inferior orbital fissures. Well, I'm going to use this skull right here. In the orbit, you should be able to see two fissures, a superior and an inferior, right? I'll put the here just for your standard, just for standard for comparison. I have it in this superior fissure. Can you see the inferior below it? If you can't, please let me know. Can you see the superior? Can you see the inferior below it? They look similar. They're just located in different positions. Can you see the superior orbital fissure? The inferior below that? Okay. Superior orbital fissure? The inferior is below that. Can you see the inferior? Can you see the superior here? And the inferior here. What do I have the pointer inserted in? You got it. Now I have it in the inferior orbital fissure. You got it. Good assessment. Can you see the inferior?
The inferior is hard to see in the spinal bone, right?
I'm sorry?
It's hard to see in the other.
It is because we don't have that, we don't have part of the maxillary bone adding that contrast for you to see the whole thing. But I could show definitely the superior orbital fissure just using the sphenoid because it's created by the lesser and greater wing. Can you see? But I wouldn't ask you about the inferior orbital fissure, you see. I'd like to move on. The ethmoid bone. This is an irregular bone as well.